State Primary Healthcare Board recently held a media dialogue on the polio-rubella vaccine, bringing together participants from the media, State Primary Healthcare Board, and other partners. The aim of this dialogue was to sensitize stakeholders on the ongoing polio-rubella vaccination campaign, which targets children aged 9 months to 14 years across the state's 23 local government areas. Galaxy TV's Bosan Yakusa has more details in these reports.
The Kaduna State Primary Healthcare Board say it will commence an integrated measles and rubella vaccination campaign aimed at immunizing more than 4.2 million children across the 23 local government areas of the state. The campaign, supported by UNICEF, the World Health Organization, and other development partners, targets children between the ages of 9 months and 14 years as part of efforts to curb the spread of childhood killer diseases. Speaking during the flag-off of the campaign, the Director of Disease Control and Immunization, Dr. Hamza Ibrahim, said the exercise will help reduce the number of zero-dose children, those who have never received any vaccine in the state.
The federal government was a National Primary Care Development Agency, Kaduna State Primary Care Development Agency, and development partners working in the state, that the UNICEF and other partners plan to conduct the rubella measles vaccination across the country. Well, the vaccination has been phased into 2 phases. Kaduna State happened to fall under the first phase, which this is the largest campaign ever will happen in Nigeria.
Also speaking, the state health educator, Kaduna State Primary Healthcare Board, Yusho Isa, said the integrated campaign will address several vaccine-preventable diseases, including measles, rubella, polio, and diphtheria. He added that adequate arrangements had been made to reach children in hard-to-reach and security-compromised areas, including those in internally displaced persons, IDP camps.
Security compromise, or those ones that are hard to reach. We already planned that, and we already communicated and collaborated with all the security agencies, key community stakeholders, and other relevant organizations to ensure that we had access to all those communities. And the question is that each and every child that is aged 0 to 14 years will get the required vaccines within the space of 10 days.
Very well prepared because we've been preparing for this MR implementation for the past 3 months. And this is something that we meet daily to discuss issues around the implementation, looking at all the working groups, because the coordination is coming from the EOC under the leadership of myself as the incident manager, and of course the executive secretary and the directors are the one giving us guidance.
Health authorities advise parents and guardians to present all eligible children for vaccination at health facilities and temporary posts across the state, stressing that vaccine is free of charge. Bosan Yakusak, Galaxy TV, Kaduna.